Morning. Thank you. Good morning, fellow Deltons and most esteemed supporters, ladies and gentlemen. We welcome you again to our weekly press conference. Last week we spoke about education. This week we speak about health. Antonio Obuh has consistently said education and health shall be his priority if elected as the fourth democratically elected governor of Delta State. When Antonio Obuh talks about health as a priority, fellow Deltons, I understand him personally. As a 16-year-old boy in 1991 when Delta was created, my own father, Barrister George Ukey, was the first commissioner for health under the then administration of Luke Chiduba Uchulo, the first military administrator of Delta State. So I understand him when he talks about health being a priority. Fellow supporters, ladies and gentlemen, a health structure is an important institution in Delta State. But if this institution must be sustainable and viable, we must not neglect it. We must move it to do the needful. Unfortunately, fellow Deltons, very few of our people have access to limited health care delivered by a highly stressed, fragmented public health service. Fellow Deltons, ladies and gentlemen, the gap between the high and low in terms of maternal death, infant mortality, and life expectancy has widened. That is why when Antonio Obuh talks about health being a priority, today we propose a new health plan that would ensure that every man and woman, boy and girl in Delta receives the health care that they need. 1. We shall build and create a district health authority that will take care of local needs. The Otito, Ebube, and a Foundation 2012 in their research discovered that 45% of local managers spend their time running to Asaba to get permission or seek clarification. 45% of the time, fellow Deltons. This is the time they would use to take care of local needs. That is why an Obuh administration will empower the district heads to ensure that local people get what they deserve. We shall back this power up with existing laws or amend where necessary to ensure district officers are always in their jurisdiction, attending to local people and meeting the local needs. 2. The Ifeanyi and Clementine Foundation also discovered that past administrations have tended to over-centralize and over-politicize health issues, and they've lacked the administrative will and the political will to deal with this issue. That is why Antonio Obuh promises today that when elected, we shall have the administrative will, the political will to administer this necessary overhaul that our health structure needs. We shall, after backing our district heads, ensure that our nurses are retrained. Fellow Deltons, I'm pleased to announce that one of the most powerful private agencies in Georgia State has promised to partner an Obuh administration to ensure our nurses are retrained in terms of personal services, promotional, preventative, and curative issues, and non-personal services like the epidemiological surveillance. Epidemiological surveillance is about using technology to fight the outbreak of virus, like the Ebola virus. We shall use technology to advance the cause of our people. No health sector in the world can advance without technology. We shall also ensure that our nurses, those our students that goes into each of our training colleges in Delta, shall be twined with college in Georgia State to ensure that your diploma and certificate shall have this college in Delta State in the United States of America, so that when you graduate, you can hold your head high that you have a college degree that is acceptable in the United States. We shall also ensure that we build and upgrade our present structures in terms of hospitals. We shall equip them with up-to-date equipment backed up with technology to ensure that it meets 21st century healthcare needs. Once we build capacity, we shall now look into the pay structure of our health workers to ensure that the pay of our health workers is comparable to anywhere in sub-Saharan Africa. Once we rebuild our structures, empower them with necessary policies to ensure district heads are empowered to take care of local needs, we shall now liaise with the Nigerian Medical Association, the Nurses Association, and other health institutions to ensure their code of conduct and ethical code shall be used to hold them accountable. So that when you are in Okbe, local needs in Okbe health needs in the car, health needs in paternity shall have a common protocol. And we believe our people deserve the very best in Delta State. Once this is done, we shall now ensure that we begin and continue to lay that foundation to make it sustainable. But we also recognize that this structure and this overhaul will not be possible if we do not look into the financial notes of health structure in Delta State. We shall ensure every ₦1 spent by an Obuh administration shall be tracked to ensure the efficacy and to ensure that it adds value to our people. Where we find that such programs or services do not add value, government shall not hesitate to close down that program and redistribute that money to areas where our people need it most. Once we do this, you can be assured that our health structure shall be one of the best in this part of Africa. That is a priority Obuh has promised to tackle. We shall have the administrative will, the political will, and the necessary health policies to back this up. Fellow Deltans, this is what we shall do if Anthony Obuh is elected as governor of Delta State. What you must do is to continue to take this message to our people in Delta. Deltans in diaspora must continue to call home and spread this message that Anthony Obuh remains the best man for Delta State. As November 29 draws ever closer, we must take this fight to the people. We must spread this message that Anthony Obuh remains the best man. We understand that the journey of 1,000 miles begins with the very first step. We shall walk with you. We shall celebrate this movement with you to ensure that the best man that will move Delta to higher realms is elected as governor of Delta State, and that is Anthony Obuh. In drawing out our health plan, we had to look into the administration of Dr. Oduaga when he was the Commissioner for Health in Delta State. That was when health was best celebrated. That was when our people enjoyed health the most. Anthony Obuh had to commission some men and women to look into the plan of Dr. Oduaga as the Commissioner for Health. We shall build on that legacy. And we believe generations yet unborn and posterity will be fair on Dr. Oduaga during his administration as Commissioner for Health. So fellow Deltans, ladies and gentlemen, this is what we shall do when elected as governor of Delta State. Last week we told you of our education plan. We told you how we're going to re-engage our students in terms of problem solving, critical thinking, to ensure that science, maths, and technology shall be a priority in our schools. We told you how we're going to upgrade our teachers in terms of IT skills. We told you how we're going to ensure that we look on how to appreciate our teachers, those who are doing what they should be doing, in order to inspire those who are not doing what they should be doing. We told you how we're going to reconnect all schools in Delta to ensure that they have internet connection. These are the things we will do when elected as governor of Delta State. So when Anthony Obuh talks about change, this is the change we believe in. A change that will move Delta State to higher realms. A change that will affect our people in terms of education and health sector. Ladies and gentlemen, vote Anthony Obuh as the best man to move Delta to higher realms. God bless Delta State. God bless Anthony Obuh. God bless our people. Thank you very much. Thank you very much.